Hey, how you doing, guys? So this is Dr. Sai at Specific Chiropractic. In this video, we're going to talk about Sjogren's and also tinnitus. So go ahead, including the viewers, what's your experience with Sjogren's?
Sjogren's, I have intense dry mouth, dry nose, dry eyes, basically the main culprits of all my, what do you call it? Not pains, but it's really just annoyances. It's been happening for, what, 6 years now, I want to say. So
6 years is a long time.
Mm-hmm.
What about the tinnitus?
Oh, tinnitus, it came up like about a month ago. It's been constant ringing in my ear, non-stop. One day it just went out, there was some loud music, I went home and it just woke up and it just never went away. So I went to the ENT, nothing, went to audiologist, nothing, primary, nothing, neuro. So I was like, okay, maybe I gotta try something else. And so I was like, I want to try chiropractic.
All right. Okay. So you pretty much covered it right on the dot right there. So Sjogren's syndrome is with the dry eyes, dry mouth, dry nose, anything to do with the mucosal membrane. All right, and that's what these fellows are right here. Right. Now, if there is some kind of nerve dysfunction, upon my experience, it's usually around this region of the nerve system. If something that's compromised and resulting in nerve dysfunction over there, as you see over here, it affects mucosal membranes. Okay, so therefore, it may explain why it says, "Oh, wait a minute, what's going on with the eyes, the nose, and the dry mouth, all that stuff is driving me nuts." But also, this region also deals with the thyroid. Right? So why is that important? Well, we talked about during the consultation, sometimes you experience those cold fingertips and the cold toes. Okay, that's a classic sign for hypothyroidism. Right? Now, the interesting thing about, upon my clinical experience here, is that 50% of the time with the tinnitus ringing in the ears is actually hypothyroidism. So that's why I was like, what's going on over there? Because this region of the nerve over here happens to be the same exact nerve that may help you with the mucosal membrane, trigeminal nerve. But it's also where the vestibulocochlear nerve resides around that level as well for the hearing. So that's why I noticed like 50-50 chance that 50% of our patients, when I do address and restore nerve function here, they get better. And the other 50% did not. And I was like, what's going on with the other 50% who does not? And then that's where we found out, nope, it's actually from hypothyroidism. So now that being said, and also to the viewers as well, okay, if there's a hypothyroidism problem over here, and we cannot restore we cannot restore enough nerve function to the thyroid, enough of it, right? Don't be surprised. The tinnitus may or may not respond. Okay, so we're going to find that out, including your viewers. We're going to find out if, after adjustment, see what's going on with that stuff. Okay,
perfect.
Right. If it does not, then I would definitely recommend go back to your endocrinologist, do a full thyroid panel, and see what we do to get your thyroid under control. And when the thyroid calms down and the levels and all the blood levels start to level out, you may notice that ringing in the ear starts subsiding and calming down.
Okay. Wow.
So now let's start piecing things together. So the history, consultation told us, okay, we got Sjogren's syndrome, and we got the tinnitus, potential hypothyroidism. Okay. So since it's usually around this area, and that's where they found out, okay, what's going on with this fifth cervical vertebra over here? It's backwards, and the disc over here is swollen, right? And there's some degeneration on that fifth cervical as well. So that fella, I really want to confirm on you during the examination itself, see if that's our potential candidate. But that being said, even though I only just this one over here, is it actually going to stay put? That's an even more important question, because most likely it's not. Because all these structures is sitting on top of a foundation. So let's trace down. Where's any potential problems? So I already see there's a swollen disc on the lateral right there. Okay, that's second dorsal vertebrae, and it is side slept over here. That means the bone itself. Okay, I'm going to see it like this. Okay, I'm going to see it smack in the middle. Another way to see it over here from this standpoint is I don't want to see it rotate so much it goes like that. Okay, so just like our body over here, if it's twisting so much, it torques, right? The vertebral body also does something similar too. However, we have these two bones over here, it prevents it, so no matter how much I rotate, see this? Doesn't rotate beyond that. But however, yours is rotating so much, see how this one over here? Rotates so much, it's starting to go off in relation to that. So, that's what I'm seeing over here, number 2. This bone is bulging out on the side. And this one over here is concaving in this word. So number 2 is another candidate we want to take a look at.
Okay.
I see there was a 6th dorsal vertebrae. I'm seeing over here, there's rib shadow over here. Okay, see, everything should be symmetrical, but what happened is, it's almost like a sunken little pit over here. Okay, same thing with this vertebra over here, number 6. There's also got degeneration over here, swollen disc over here, open up on the back as well. Okay, and this thing's also tilting more as well. When we take a look over here, oh yeah, it's really tilting over this way. So that's another canyon we want to take a look at. In addition to, see all these ribs, they're all symmetrical. What happens to number 6? It's tilting this way. So we want to take a closer look what's going on that particular level. Trace all the way straight down. Okay, keep on going all the way straight down. Okay, this 4th lumbar is tilted that way. See as well, all these discs, it's all swollen over here. I don't want to see these ball bearings. See that circle shape over there? I don't want to see that. But this one, number 4, is pretty swollen. You keep on tracing down, keeps on going further, that means the foundation itself is unstable. So what's going on in the foundation? Well, this line over here, I want to see a smack in the middle. It's off to the right. Also sunken down on the right hand side, taller over here. So that tells me what happened is your right hip, it went backwards like this, okay, rotated this way, and it's sunken down this way. So you tell me, with this complicate, this combination like this, you think we go up this way? No, I don't think so. And even more fun and kicks and giggles is that we also have some arthritis on this side, and that comes from external rotation of the right hip, because it's a crisscross pattern over here. So that tells me, no, this is not a recent injury. It's been there for a while. To cause that kind of arthritis, we're talking about, past 10, 15 years, you probably knocked this right hip out. All right? So also, again, we're going to confirm that on examination on you, see if that's our candidate that we need to address. Okay. So then, now we're talking about, we're going to take a closer look during examination on you, confirm our hunches, this right hip, 4th lumbar over here, take a look what's the 6th dorsal, 2nd dorsal, and that fifth circle over there. All in the purpose of trying to recenter and re-level your atlas over here, which is shifted towards like that. Okay. So by addressing all of those, we'll eventually recenter it all itself and cause a lot more fun stuff as well.
Interesting you say that. Is that why I've been having like pain here, like on my chest? Because I thought it was my heart. So I went to the heart doctor. It was not my heart. He said it was all good, but it went away. But every now and then I get pain, like right here.
Bingo. Because we showed over here as well to the viewers too, that your ribs, they're both misaligned. So think about this. If this vertebra is soft, okay, our ribs attach right here to the transverse process. It's like a hook, like over here. And it wraps all the way around to the very front. That's how it makes our rib cage over here. So if this bone itself is rotated quite a bit, see how much it rotates this way? Like that way? Those ribs, it's gonna follow as well. It has no choice, because when we rotate that much, the ribs have to move. So, and the ribs gonna pop, it's not gonna be fun. All right?
Very cool. All right.
You got it. The first thing we want to do is we always want to inspect and see what's, as in, it's sort of like that old Sesame, Street episode where, which one does not belong where, or what doesn't look like the others. So we want to see, okay, is anything really standing out? Okay, and I'm looking for is any of those muscle spasms or swelling, something that doesn't look right. And see, it's puffiness over here. See, there's swollen over here, right at the 2nd dorsal level over here. We're going to mark that level, and it sinks in there. See, I trace my finger, and it sinks over here again. Look, there's a little pit. Mark that level. Keep on tracing all the way straight down. Got something here. Tender right here.
Teeny bit, yeah, out area.
Right there. Huh? Now the reason why it's tender over here, okay, the swollen over here, because when the hip itself, when it rotates, see, it's going to open up a gap over here. And that's where we're examining and testing, is that when it opens up and pulls away like this direction over here, there's going to be extra fluid over here, and it's maybe tender on that side as well. So we got that fellow over here. Same story with this one over here. There's a speed bump over here. Everything is swollen here. Body trying to protect and stabilize this one over here. The neck. Yeah. See, right hand side. This is swollen over here. See, and this feels like a speed bump. You feel that fellow right there?
Mm.
Yeah. See that? Feel like one big knot right there. You feel that?
Mm-hmm.
Yeah. So let's take another look. So now with instrumentation, this is just checking for any signs of that inflammatory process. It gives us potential clues in which area we want to focus on. We try to follow a good old saying, if it ain't broke, don't fix it. This one, see, it's been chronic for there quite some time. That's why it's a small little reading at that fourth lumbar level. And tracing down even more. See, we also got another small reading at that pelvis as well. So the next component of our examination is we want to check, see what's not moving too well. See? Feel that right there?
Yeah.
Yeah. That's where that camera is. How's that fella right there? Yeah, fourth lumbar is like a brick wall in there. You check, see how everything else is moving, which not too great. And then we come to this fella right there.
Yeah. I think that log is cracked.
Yeah, there's that sixth dorsal right there. You feel that fella right there, huh?
Mm.
Yeah, it's that fifth cervical right there. Not sure. Just let it go. Let it drop. Excellent.
I feel like I can breathe better right now. I don't know if that's a side effect, but I feel good. Yeah.
Any difference do you notice with your eyes, nose, or mouth?
No, but I can breathe better. Like it's visibly like different that I can breathe better. I don't know if that is a symptom of the chiropractor right now. But that's right now the most immediate thing I can feel right now is the breathing. Yeah.
Okay.
Mm-hmm.
Any other changes you notice with your dry eyes, mouth, or nose?
Well, it's funny. I do have saliva right now. Like I don't know if that makes it, but eyes, no, not my eyes. I don't feel anything with my eyes. But no, I think it's very visible. I can breathe better right now. I don't know if that's a symptom of like whatever was just done, but I can. It's like trust me, I've had it for a long time. Dry nose.
Mm-hmm.
And I can breathe better.
Okay, no,
Yeah.
that's good.
Yeah.
Any difference you notice in your hearing?
Wait a second. Oh, it's very faint now. Like it's very like before it was like I can't say level 1 to 10 like a 6, 7. Now it's like a 1, 2 or like I have to really like make sure I still have it. Yeah, it's like very low. It's very low.
Hey, that's great.
Yeah.
Hey, we'll take it.
Yeah.
All right. So here's what you do, okay, for your homework.
Mm-hmm.
Okay? You're gonna ice your neck over here, 20 minutes, 3 times a day. Let it calm down. On our next visit, you let us know how your Sjogren syndrome is coming along, the dry eyes, nose, and mouth.
Mm-hmm.
All right?
They're perfect.
Okay.
All right.
Set. I'll see you next time.
Appreciate it. Thanks, Ashley.
Oh, you're welcome.
Thanks, man.
All right. So give us the latest updates. How's everything coming along with your Sjogrens and also with the ringing ears?
All right, so the tinnitus is back a little bit.
Mm-hmm.
In regards to the Sjogren's, like my nose is much less dry than it was before, 100%. That's really the main, I wouldn't say like my mouth has been probably less dry, but it's really most significant in my nose, 100%.
In your nose.
Yeah.
What about the eyes?
Yeah, eyes too. Yeah. But I think it's just because I've been focusing on my nose so much that I forget how less my eyes might dry. I don't use as much drips anymore.
Mm-hmm.
And the mouth not so much, but I used to chew a lot of gum. But my nose is probably the most, you can tell.
Nice.
Yeah.
Okay, well, it's a work in progress. Okay, we're still going to continue. We're still more your function, okay, to get your, lacrimal glands and all the mucosal glands, get those working again.
Mm-hmm.
And also we'll get back to working on restoring your function for your hearing as well for the tinnitus.
Okay.
All right, well, thank you for the update.
Appreciate it.